Hi, I'm Susie with Firehouse.com, and with me today is
Captain Dale Becker, Harrod County Fire and Rescue.
Captain Becker. Can you explain, the CPR and the Resuscitation Academy and what's going on here today in your program here?
Sure. Today is a joint effort between Harrod County Fire and Rescue and the Resuscitation Academy program from Seattle, Washington. Our program is called CARES, Cardiac Arrest Resuscitation Experience Symposium. And the whole idea is to improve cardiac arrest survival by using lessons learned from the folks out in Seattle and King County, Washington, and to improve the way we manage our cardiac arrest so more people are being saved that experience a sudden cardiac arrest.
What program unique to Howard County, and can you explain a little bit about it?
Sure. The focus is really on quality improvement. So we look at all the data and look at how we manage a cardiac arrest, and then develop a protocol or a procedure so that we can maximize our treatment efforts in order to improve the cardiac arrest survivals.
So how many students are here today?
I believe there's about 60, and they represent, I'm not sure how many jurisdictions in Maryland, but there's quite a few. We have people from North Carolina, Pennsylvania, and even a gentleman from Montana.
So you're looking forward to kind of implementing some of the things they've done out in Seattle to change the survival rate here?
That's correct. 2 years ago I was out in Seattle and I trained with the men and women out there, and when we came back we hit the ground running. And what we've learned, I came back and started with just one company of firefighters in our county, and we practiced and trained for about 10 or 12 hours on how to improve our cardiac arrest in order to minimize the time that we were not doing CPR. We piloted that program, and the first 5 cardiac arrests that this company ran, they resuscitated every one of them. And they were all subsequently admitted to the hospital. Only one of those patients ultimately survived. But it was a big improvement over cardiac arrests of the past. It was a smoother run cardiac arrest, more controlled, didn't seem as chaotic.
And early intervention, early CPR made a difference?
Yeah, the big difference was just in the management of the cardiac arrest itself. Everyone has a role. Everyone knows what their role is before we run the cardiac arrest. So it's a lot like when we pre-plan for a fire. Firefighters ride on an engine company or truck company. They know their assignment when they roll up on the fire, whether they're first in company or the second in company. When these guys roll up on a cardiac arrest, they already know who's responsible for the airway, who's responsible for the first chest compressions, who's responsible for the time management, who's responsible for monitor AED. And that sets the stage for the first couple minutes, which is when it's usually the most chaotic. And then the officer in charge will then make the assignments and move the pieces of the puzzle around. What we essentially did was take the management of the cardiac arrest and all of the pieces of the puzzle away from the paramedics. It is not their responsibility to move all the pieces of the puzzle around, and they just focus on ALS patient care and basically work around the EMTs.
Okay. All right. Thanks for your time today. Appreciate it.
Thank you very much.